Hello, this is Aaron Shoemaker, and I'm here today with Wendy Lemasters and Amanda Place. They're clinical pharmacists, and they work with us in many different ways, but today we want to talk to you about how our clinical pharmacists are helping us with our population health needs. So the group kind of understands what we're working on. Many of our payers want us to work on medication adherence as a quality measure. In fact, they heavily weight these when they look at our overall quality, and our Medicare Advantage programs are ones that do this the most. So we've put some emphasis on this in the last year to try and improve our quality scores and our medication adherence, and we all know that this also helps with the outcomes of our patients, so it's very important. So what kind of work are we doing in this space?
Well, I have to say it's really exciting because we're actually getting paid to do the things that we should be doing anyway. What happens is that we get a list of patients from our payers that say, here are people that are taking some targeted drug classes. We'd really like them to be taking it every day because we think that's going to help their health outcomes. And so then the pharmacists take that list and they identify patients. We all have access to Athena, just like you, and we can get in and look at your charts and your plans and your goals for that patient. We evaluate the patient and then we reach out and say, hey, I'm Amanda from Dr. Shoemaker's office, and I wanted you to know that I wanted to talk with you about your medicines today and work through what barriers might be there,
right,
what's going wrong, what can we help with, and look for ways to improve the care of the patient and make sure that they're taking their medicines.
Great. How is this different than the other outreach we get from insurance companies and things like that?
So one of the things that we actually do is when we call a patient, we identify ourselves as from the insurance, not from the insurance company, but from the doctor's office. And what you get from insurance plans is a fax that says your patient should be on a statin. We actually go and look at the chart and say, did the patient try a statin? Were there side effects? Is there a reason that they shouldn't be on it? So if you're getting a task from us, we've done all that background work. The insurance company is matching two lists and saying this should be,
right,
and they're just sending you information. We're actually looking at the whole clinical picture of the patient.
So you actually have all of our information. That's great.
Correct.
I can tell you that the outcome of this has been where we've placed pharmacist resources. We've seen our outcomes and quality metrics really improve for that group, so thank you very much. I also wanted to touch base real quick, as you guys are working with us, if you could take a moment to educate us as clinicians as to what we could do in that frontline prescribing to make sure that our patients do have good adherence to their medication regimen.
Of course. Well, one of the first things that many payers are asking for is that 90-day fill, with the idea that the patient only has to go to the pharmacy every 3 months. That may make it easier for them. As a pharmacist, though, I look at a couple other things. How can we simplify their regimen? Looking for combination pills or trying to keep their doses to just once or twice a day. In addition, asking the patient specific questions. So are you having side effects? Many patients stop medicines because of side effects and they never tell their doctors, and then you don't know and can't fix the problem. And then asking about other barriers. As a patient, I might be embarrassed to tell you that I'm having trouble affording my medicines, but if you ask me, that gives me the opportunity to seek help.
Fantastic.
And one of the other things about having the pharmacist involved is we do have some resources. So we can set patients up with coupon cards, discount cards, things that they can actually do to get their medications. And we're always available for any of the physicians to call us and say, okay, I've got this problem, how can you help us?
Yeah, and that was what I was going to mention, is that we have a closer relationship than we've ever had with the medical group and our clinical pharmacists. They're embedded in many of our patient-centered medical homes, and if you have a need that's pharmacy related in your clinic or for your patients, please reach out through RUA, through your manager, through your huddles or your improvement meetings in your practices to let us know that, and we'll try and fulfill that resource and that need for that patient through our work with our clinical pharmacists. So thank you guys, and hope you all have a great day.